Good morning, everybody. I'm letting everyone get entered into the webinar, so just give us a minute. All right, still have people coming in, so just a little bit longer. Okay, we're a minute past and we're at least 25 in, so I'm going to get started. Good morning. I hope everyone is happy and healthy and enjoying their summer. For those that don't know me, my name is Maria Thacker-Gothi, and I'm President and CEO for Georgia Bio and CEO for the Center for Global Health Innovation. We're very excited about today's Coffee with an Executive, and I'd like to thank our Emerging Leaders Network for their leadership and pivoting on their event schedule for the year and looking to provide some forums like this so we can learn about what's going on in our community and continue to advance not only our young people's careers but also inform our executive leadership that across the industry that is participating. So I'm just going to cover a few housekeeping items. If you have any questions along the way, please submit them through the Q&A button at the bottom of your screen. I think today's program will be very exciting for many of y'all to learn about all the excellent activities about the Global Health Crisis Coordination Center. The GHC3 is a division of the Center for Global Health Innovation, and more details on that are going to be forthcoming in the coming months as we pull more things together in the new organization's strategic plan. But I will let Alexa introduce Ken. A couple of housekeeping and upcoming events I do want to make sure everyone is aware of. Tomorrow is a big day for Georgia Bio in particular. Tomorrow morning at 11, we'll be welcoming for our next virtual town hall U.S. Senator David Perdue. We do apologize for the last minute nature of this, but as you can imagine, the senator's schedule is quite challenging at the moment. So we're very grateful for him to take a little bit of time tomorrow. It's only a 30-minute webinar and all questions must be submitted in advance. We'll do our best to answer all of those questions that are submitted. We already do have quite a good crowd joining us for that conversation tomorrow at 11. Additionally, tomorrow night, our Golden Helix Awards are going to be at 5 p.m. Unfortunately, we had to cancel the awards dinner back in March due to the pandemic, about 48 hours in advance of the dinner. We really appreciate our sponsors continuing to support the event in this virtual nature. We already have a great crowd of well over 100 joining us to celebrate those awardees, and I anticipate that crowd continuing to grow in the next 24 hours. We do encourage you to join, especially at the front end. If you're only planning to join for an awardee, we understand and we will make that agenda transparent for you guys online, but please know that we encourage everyone to join us on the front end because we will be welcoming Scott Whitaker, President and CEO for AdvaMed, the MedTech Association, as making some keynote remarks on the great work that the MedTech industry has been doing for the last 4.5 months since the pandemic really hit. So again, that's tomorrow night at 5 p.m. Additionally, next week, we are, after some time planning this and getting permissions from our partners at CSL Behring and Takeda and their parent offices, we'll be welcoming a conversation between CSL Behring and Takeda on the COVID-19 Plasma Alliance. This is a really amazing opportunity to understand how this Global Plasma Alliance has come together under their company's leadership and other companies to really combat the COVID-19 virus, and we really encourage everyone to join us for that. This is a unique opportunity to learn about this amazing alliance that's been pulled together across the planet. And finally, next week, for those that are interested, we do have Lean Six Sigma Yellow Belt certification. This is an excellent opportunity to really build your problem solving and analytical skills and add something else to your resume if you don't already have it. So it's a busy next week and a half before the July 4th holiday. So again, I hope to see all of y'all tomorrow for our morning 11 o'clock event and our 5 p.m. awards dinner. And if not, maybe next week at 10 a.m. on the 29th for our Plasma Alliance call. With that, I'd like to turn this over to our ELN leader, Alexa Morris, to kick us off and introduce our speaker. So thank you all again, and we look forward to seeing you at our next event. Alexa?
Great. Thanks, Maria. And thank you everybody for taking the time to join. We really appreciate it. And of course, thank you to Ken. Before we jump into talking about Ken, just wanted to give everyone a little bit of history on this event. So this actually used to be a dinner event, which we would have students and young professionals spend time with an executive, small groups. They'd be able to ask a ton of questions. Obviously with coronavirus, we can't meet in person. So we've opened up the format. So now that it's virtual, we're hoping to have a lot of students, young professionals, and others that are further along in their career. So today we are very grateful to have Ken Berta, the Executive Director at the Global Health Crisis Coordination Center, based in Atlanta, but Ken is actually based up north a little bit. But Ken, thank you very much for taking the time to join us today.
Certainly glad to be here. Thank you, Alexa. And thank you, Maria, as well. It's very exciting to talk with another young leaders group just about what's going on today in COVID, introducing you to GHC3 and talking through different career paths here that we have in life sciences and med tech and public health.
Yeah, fantastic.
So happy to be here.
Great. And so since this is Coffee with an Executive, I will ask you one coffee related question and then we'll jump into the actual stuff. But can you tell us about your coffee mug?
Yes, I have my my Star Wars coffee mug here, one of my favorites. I have several of those, and I have an Ethiopian dark blend that I'm drinking this morning. So
very nice.
Very
All
good.
Right. So let's get started, and definitely want to take some time to have everyone get to know you a little bit more. And also just one other thing to mention real quick, as you have questions, everyone please ask them in the chat feature, the Q&A feature. We'll make sure that we have plenty of time at the end to answer any questions. So feel free to, as we're talking, if you think of something, feel free to put it in the box. So Ken, I know your background is super interesting and really diverse. I would love to have you start out maybe and walk us through your career path.
Sure. Well, I started out as a kid as kind of a science geek anyway, so really liked the natural sciences and how to work that together. But on the other side, I was that kid that took all of his toys apart and then tried to put them back together. So it's a mixture for me of science and engineering. I think I got my first microscope when I was 10, and just exploring the world as kids do. That's around you, and then started looking into experiments and other things that you could do as a young person. As I moved through high school into college, in high school I did a few things with the National Science Foundation just around experiments that could be run. Won a couple of awards with that in AP Bio and a couple of things that I got into early on, which drove me into what do I want to really do with the rest of my life here. And in working with some of the scientists, I grew up in an area of Ohio that's very close to Wright-Patterson Air Force Base, which is also the home of the Air Force Research Laboratories. So had a lot of scientists in the neighborhood as well as I grew into my teens, talking about the stuff that they did at work, which part of that was the Human Effectiveness Wing, which is where pilots were tested early on. The Air Force was one of the first science organizations within the military to really start studying the effects of altitude and those kind of things on humans. So that spawned the Armstrong Labs, which later moved to Texas. But anyhow, the Armstrong Labs were a big group of scientists around the Dayton, Cincinnati area that really formed a big community here. There's also something called the Dayton Engineers Club, which is where Charles Kettering and Sloan and those folks all developed their technologies for automobiles. So there was a huge engineering group here in the region as well. So a lot of science and engineering influences all around me. In trying to mix those two things together, there was a new discipline that had been developed called biomedical engineering. So I thought, well, that's a good combination of what I think I like to do. So I went into that. It just turned out there were only 8 schools in the country that taught that at the time, and one of them happened to be right across from Wright-Patterson, called Wright State University, which shared their scientists with Armstrong Labs. So it was a great way to jump into something. And as that program developed, which really was going through accreditation at the time, we were still trying to mix together science and biology with fluid dynamics and electronics and all those things that go together in building machines that interface with the human body. All relatively new. I think a lot of my textbooks were still typewritten, right? Because they didn't even publish a lot of these as they pushed them out. This is, shortly after the Barney Clark, I don't know if you're familiar with that, but the first artificial heart patient, which was really interesting to me at the time. And I got into artificial organs then in working with how to design artificial kidneys and those kind of things. So my degree really started to focus on artificial organ design and then the rehabilitation of that afterwards, until I started working in a laboratory where they were working with handicapped adults, folks that had spinal cord injuries or MS or other degenerative neurological disorders, and they were getting these patients up and walking. So it was quite fascinating. There was actually a movie called First Steps about this lab. I'm student number 2 in the movie. But it is, but I was just a student. I wasn't one of the big drivers, but the team got nominated for a Nobel Prize, and it was a very heady place to be at the time, just as a young person working as an undergrad in a very high profile lab where 60 Minutes and 2020 and all these TV shows are showing up trying to put your work on television. I got lucky enough that the person who was presenting some of that research at a big DC conference got sick as we were going out. I had, in my own way, started to design my own technology in the basement of that lab to help me do my work in the lab. And part of that was moving these patients around. So I designed a transfer chair that allowed you to move quadriplegics and paraplegics around the lab where they could move themselves and be able to get on and off. It was called a transfer chair. I ended up getting a patent on that. So I was taking it to this conference anyway to show it off. And the person who was going to, talk about the research got sick. So they asked me to do it since I was already there. And some man in the audience stood up and waving his business card around and walked up to me afterwards and said, "Hey, we're just starting this new division of called Child Healthcare Corporation of America. We think all of your skills here fit into what we're going to do, and we're trying to hire biomedical engineers to build out our portfolio. So would you consider coming on board?" And I hadn't even graduated yet, so I got really lucky getting my first job out of the audience of a presentation, which was fantastic. And they sent me to Denver and other spots around the world to learn how to take children with multiple handicaps out of the hospital and into their home. So what systems needed to be designed to do that, to build that, whether it's a respirator or it's transportation related or just modifying the home so they could live in it. All of those things the Child Healthcare Corporation of America wanted to provide, because they were owned by and still are, the 35 largest children's hospitals in the country. So they wanted to move back into their hospitals a service suite that children and families that were leaving their hospitals could leverage as they took their kids home, and then moved on into the rest of their life. I was assigned, strangely enough, to the Columbus office, so I didn't have to move far from where I grew up. And that was now what's called Nationwide Children's Hospital, which is affiliated with Ohio State University, wanted to start a PhD program around rehabilitation medicine. And so they offered me a spot to start to build that program out and be student number 1. But in the middle of that, another company had found a patent that I had while I was an undergrad and offered me a position to lead their product management group in a whole nother discipline in emergency medicine. So how do you move patients, still moving people, still medical device related, but how do you put engineering and more engineering design into the process of rescuing and delivering care in the field? Very interesting, area because of the history of emergency medicine. Really, it started out as something that happened with the funeral director, believe it or not, and that's why they painted their ambulance, their hearse white and put a dome on top of it, because the first aid department was run out of the funeral home. And then they moved when the medics started coming back from Vietnam. they started to really ramp up what field medicine can do. So in the early 70s, they started to certify folks as paramedics, which was, you know, a license that you would get. Most of them were nurses that were moving into the field because you had to be able to deliver drugs and do some interventional medicine rather than just a first aid person who put you in the ambulance and got you to the hospital as fast as you could. Well, this company, Ferno-Washington, was the grandfather of that industry, really. They invented that one-man stretcher you see on TV all the time that people roll in and the legs go back and it goes back into the ambulance. That all started out as something to move folks into the morgue, believe it or not. That's how that product got started. But they wanted to add some engineering to it. Defibrillators, the delivery of advanced medicine in the back of an ambulance all got started. So they wanted to really beef up the engineering capabilities of that, and gave me a lot of leeway into what I could do in that company. It's a private firm. Again, even though I always wanted to move out of Ohio, this happened to be now just 50 miles to the west of Columbus, or east of Columbus, so I didn't have far to go anyway. And I started working with this company as a product manager, and within probably 13 or 14 months, I was the head of R&D, because this was a whole new area, bringing a biomedical engineering discipline to really what mechanical engineers had done in the past. So how do you modify products that fit the body better, that can isolate heart sounds, just the things that we had learned in biomedical engineering to put machines together with humans. How can that be applied in emergency medicine? And then as we started to develop all over the world, I had labs in the UK, Germany, Japan, in Croatia, Mexico, other parts of the world, where we could develop products that are specific to those countries. Because as you can imagine, every country would want to have its own ambulance be from a vehicle that they make there, that they manufacture there. And, you know, if you're working in Holland, people are a lot taller versus working in Japan. So the vehicles are a little bit more compact. So you'd have to redesign how all of that fit into an emergency vehicle to move out. And then quickly from there spun into high angle rescue, ski patrol equipment development, which I will say was really fun for me, because I got to go skiing in different places all over the world, testing out equipment. Yeah, every winter. It was a fantastic time. That was a lot of fun to be able to do. But all this was based on, you know, a background in science and engineering, and the ability to instill some level of confidence in the ownership of this company, that these new products would not only be marketable, but also we're advancing the science, right? Advancing how we care for individuals on the ground. And it's different everywhere. We served about 130 different countries at the time. We had facilities in 90 of those. So we would, you know, in France, for example, a physician always rides in the ambulance. So there's a lot more technology that you can put into that ambulance, because they'll actually pull over and do surgery right there on the side of the road. Versus in Hong Kong, where there's really no good spot to be able to do that. And they're only, you know, the hospitals are huge but far apart. That was more about getting them to the facility faster. Where in the UK, the National Health Service was also responsible for just taking you to the doctor. So the ambulance had to be convertible to these like mini buses to pick people up and get them to the doctor's office. So all kinds of different demand. And I think success there was more about becoming a student of that. So I rode along in ambulances as much as I could, just to see how the paramedics, doctors, ambulance people, depending on what country you're in, they all have different titles, would do, and how they would interact with patients, and how they'd interact with the emergency department once they got there. So just being very immersive in what it is that you're working on, to understand how the users actually touch and use your products, and how patients react to that too. Because, you know, your customer will always have a customer, you know, of somebody that's going to buy the product they're making, or share with their family, or whatever that might be. So there's always ancillary touch points to whatever product you're developing. So it's good to learn as much as you can about that from their perspective. And also remember that you have experience in that as well. Everybody's had to put a Band-Aid on a wound sooner or later. So what was that experience like if you had to go to the emergency room with a loved one or a friend just to take them there or pick them up and see what that experience was like? How would you improve that if it was for your mother or brother or sister or child? So when you put that in my design teams, that was always something that we would talk a lot about is, this isn't just this coffee mug here. I mean, you're designing products that are saving lives every day, and that life could be someone you know.
Yeah.
So that becomes more of an ennobling and principle-based leadership style as you're working with people. And some of the challenges I had there were really about the fact that I was only 26 at the time, and I was younger than everybody on my staff. Let alone the people that worked on the manufacturing floor and the other executives that were there. So a lot of that is finding out their concerns about you because you're a younger person and you're moving up rapidly. So that can be threatening to them. Hey, what do you know? You don't have a lot of life experience, but if you immerse yourself in what you do, you can have a lot of experiences about what the problems are you're trying to solve. And oftentimes people don't always take that path. So if I was on the shop floor and somebody asked me, why'd you think of doing it that way? Well, because I've ridden in 150 ambulances in the last 2 years, and this is a problem. Here's why.
Yeah. I think that's such a good point
Yeah.
for especially young professionals, the age discrepancy, but also really just for anyone at any age, understanding what the user's needs are and understanding the customer really, to spend time doing that. So that's great insight.
Right. And analytics, oftentimes when you come into a new business or company, you're put into a position to do a lot of analytic work, and you get really focused on, building out this deck or these numbers or whatever your job might be, without asking a lot of questions about why that content's going in there.
Mm-hmm.
What is it? How do you learn about it? And if that's not something that you can really get from your immediate supervisor, find out from other folks what's important, or that you can actually give some input into, here was my experience, regardless of who you're working on with, this has been my experience in this. It's harder in higher technology areas because what experiences did you have in creating a drug, right? Really, you haven't, but you've seen a lot of drug commercials, right? You know how people react to that drug, people that take them. So all of those are applicable to the problems that you're trying to solve here. How people understand the effects of that or whatever therapy it is you might be working on. So a lot of pieces in that. And then that grew, from there, that grew into just doing a lot more international work, which I have to say was very fortunate spot to be in, to be all over the world. The company paid for my graduate studies. So I went to Xavier University to get my international business MBA, which also put me into Sophia University in Japan. So I had to split time. I was running the Japanese operation as well as being the head of R&D at the same time, because we were opening up a new facility. We worked specifically with Toyota and Isuzu and all the manufacturers, Nissan, who built the ambulances. Unlike the US, where they come off the shop floor as a frame and then outfitters build an ambulance, all of that is done on the main line of a Toyota facility. So because it was so design heavy, I got involved in that business, and they said, well, why don't you just be the managing supervisor of that business as we move forward, which was good for me. And then I came home and moved back into the corporate business to then expand the network into wholly owned subsidiaries that we had, to build those out and also put design shops in each one of them, so we could build closer to the customer rather than trying to bring it all back to a central location. And that took me into a lot of organizational development, a lot of study around everything from principle-centered leadership to how do other companies do this work. And again, if you ask to go visit somebody's, I visited like a Ford factory, a GE facility, just because I wanted to know how they did it. And it's remarkably easy to get in and say, I want to learn more about how you're doing something, or I read this, would you give me a tour? And rarely was I denied that opportunity. And as I moved that together, there were big conferences around how business change can happen and how teams can be built. And pretty soon people were quoting me in books, and I was giving talks at big big events, and became a speaker for the International Chamber of Commerce on how to do business overseas and how to work in Japan. And as I was moving up through this company, you know, I put my years in. I was there for, I think, 8 years at this point to build this up, and it was a family-owned business, so there was going to be a natural transition into leadership, where one of the sons that I had worked with would take over the company, and I'd become one of the COOs. In this process, I'd gathered so many different experiences too, and that being the head of research and development was really a part of I also had all of marketing under me, which was a little different. But as you can imagine, those who know the product can really push it out faster. And since our teams were interviewing customers constantly, it became a good marriage to put those two things together. But at the same time, we were also applying the organizational development changes that I had been working on to make R&D go faster, and then tying that into the factory. So there was a lot of aspects on how to run the business that I got involved with. And one was probably a very interesting set of experiences was being the lead for the product liability defense team. So I've been on the witness stand in many different countries, defending a design or how it was tested or its use, because you can imagine in emergency medicine, you're on the side of the road, you're, you know, in not great conditions as these products are using, and if something goes wrong, well, besides the municipality or the county or whoever's using the product, the only one to point a finger at was the biggest company that made those products, which was us. So we were in probably 50 lawsuits at any one time, and we never lost one in my whole tenure there. Matter of fact, I don't think the company ever lost one, to be honest with you. And this is hundreds of thousands of products. We have 3,000 products in our product line, and, you know, hundreds of thousands of products in the field in many different countries. But we did a lot of testing, a lot of pre-work to make sure that there was a lot of safety around it. Anyhow, as we got into growing and transitioning the company, I was in London, and the owner was like, I'm not ready to get out of the way. It's probably going to be a couple more years. I was, you know, ready to go. Joe, who was his son, and I had a lot of plans on how to double the size of the business, so we really wanted to get moving. And I went back to my room. I was a little disappointed, and the light on my phone was blinking, and I picked it up and called the front desk. They said, "You have a message from this person." I didn't know who it was even, so I called him up, and it was the board secretary for a company called Yellow Springs Instruments, whose CEO wanted to talk to me. They'd seen me speak about doing business in Japan at the International Chamber of Commerce meeting some time ago. I had not met him, but he talked to a lot of people about who I was, and said, we're about to move into Japan. We'd like you to take over this whole division of our company.
Similar to how you got hired in undergrad.
Yeah. So it's funny because when I called, she's like, "Oh, well, he's gonna have to call you back because he's in London right now." I said, "Well, I just happen to be here also." That's weird. So she's like, "Oh, okay. Well, he's at this hotel." So I went and met with him, and then came back, and there happened to be a board meeting that week, and he introduced me, and that was my interview. And they asked me if I wanted this job, if I could do these things, and it was fantastic. So I took that over, which was hard. I mean, it's hard to transition from something that you've spent a lot of your time and life in. Not only did I do a lot of work at Ferno around designing their products, I also wrote the standards for the European Union on how ambulances and patient transportation should work as the EU started building its own standards. So I spent a lot of time at The Hague and with those teams, because we had developed those standards in the US, and I had done more crash testing of emergency vehicles than anyone else to prove out our products. So they said, "Hey, can you come do this for us?" Which was a great experience. And anytime you have international experience or the opportunity for it, because the world is shrinking, as you know. I mean, it's pretty easy to contact other markets. There is just one big market now. So all of that is impacted, and there are companies from overseas that are working here, and there are places that you'll be sent if you're working here for another company. And to me, those are always great opportunities to see not just how other cultures work, which broadens, I think, your experience and your mindset and how you think, but also just seeing how other businesses are run. it's a lot different. Working with a Japanese company, I did my internship at Mitsubishi, huge, biggest company in the world, and I worked in the soybean department, which you'd think, wow, that's fun, but it was soy sauce and soybeans, anything made of soy, tofu, you name it, and that was a $30 billion division of this company, just those 4 products.
Wow.
And the style and what you learn and how you act there is totally different. The culture of Japanese business is far different than what you'd experience in France or the U.S. So, but yeah, when you're dealing with those individuals, especially if they're your customers later, you've got a better understanding of who they are and what those different segments are that you work with.
Yeah, I think that's a great point. And especially, I mean, you've had such diverse experience and, global experience too. So I do want to segue into talking about, GHC3.
Sure.
So definitely want to learn more about your role there and also just more about the organization itself.
Sure. So I transitioned through YSI into a large nonprofit called daytaOhio, which was a big 60 company, 5 university nonprofit. One of the companies that we worked with was Philips, and they hired me. I spent the last 10 years there working with their developing a new product called in digital pathology or virtual microscopy. Anyhow, as I was building that out and working in Atlanta with Emory, building a new innovation hub, because innovation and economic development were always big things for me. I got introduced to this new Center for Global Health Innovation. I was like, well, that's neat. That's something Philips should be a part of. So we started talking about that. I managed the big relationships for Philips with Dell and Apple and Samsung and a lot of other companies. And I just happened to be working with Dell at the time and said, you should come check this out and see what these folks are doing. And there was a lot of changes happening at Philips. I'd already been there longer than I intended because my goal was never to be in a big company. A lot of differences between small business and large business, being a small gear in a big machine versus being a bigger gear in a smaller machine. You get, I think, to me, in smaller companies, you get far more experiences to move that across. Anyhow, as this thing launched, the CDC Foundation and Microsoft funded what was going to be a division of the Center for Global Health Innovation called GHC3, which is the Global Health Crisis Coordination Center. And with some of my background in emergency medicine, working with big corporates, building large partnerships with universities and other folks, it was a good fit for me. And Maria and the team asked me if I'd take this thing on. So we started as a way to become more, to operationalize what the foundation does. The CDC Foundation is really an arm of the CDC. They're for-profit, they're nonprofit private partnership arm, so that they can move faster in times of crisis, but also doing a lot of science in how the CDC wants to move forward. So they can take public monies in without the big bureaucracy of contracting and all those things that have to happen to be able to launch programs all over the world. The CDC has platforms in all parts of the world. It's truly a global center for public health. And one of the big benefits that it's in Atlanta is that it's driven up this large core competency around healthcare, specifically around public health. Because it's the only agency of the government that's not in DC, it is quite an attractant to put this together. And that's really the beauty of the Center for Global Health Innovation, is that you've got Delta in the biggest airport in the world, being able to pull people in from everywhere. You've got Emory and Georgia Tech's bracketing the capabilities of the region. And you've got the CDC, which drives just so much activity in both those universities, but also in nonprofits that are in the area. It's just really a center of excellence for that. And creating a global 911 in times of crisis was very exciting to be a part of. So we started out in really building out a capability to leverage all of the competencies of the private sector, both philanthropy and nonprofits, but also the big corporates, which was a big part of this. So you can imagine if there's a crisis somewhere and you need to get water there, for example, the way that would work with the government is that they would put out, we need so many cases of water. That would be delivered to FEMA. FEMA would put those on big C5 star carriers, big aircraft that would go to wherever that site is. and they would unload those. That water would go into a warehouse. Then there would be a distribution mechanism to get that water then to the neighborhoods where it needed to go, or the communities where it needed to be. Versus calling Coca-Cola, who delivers more water than anybody on the planet. They have trucks that go to every neighborhood already, and just saying, hey, can you make every second truck deliver water to this town, whether it's in Africa or it's in Central America or it's in Puerto Rico, which is the example I use a lot, because after the hurricane, they found warehouses full of water that never got distributed that the public could have used, especially when their water systems went down. So how do we look at a Delta Cargo versus UPS on how to deliver alternative supplies in times of crisis? So organizing that type of mechanism to mobilize the resources of the private sector alongside of what the government's trying to do and what the public sector is trying to do. So that was really the goal and drive for creating GHC3. That turned into, now we've got, now the barn's on fire. We just opened up during COVID. The CDC Foundation said, we've got to go now because we're going to get hit with this virus. And a lot of that had to do with PPE, getting equipment. How do we manage that? So we probably spent the first 6 weeks just putting together alternative supply chain capabilities to get product from China into the US or product from Taiwan or wherever it might be, whether it was masks or ventilators or what have you. Made connections with, I think, 6 different governors' offices to try to support their acquisition of product, or what we called critical equipment. The teams are structured into an incident command. So any emergency operating center has an incident command. You have an incident commander, which we have, Monty Wilson. He's a former president of one of the Wellstar hospitals. And underneath the incident command are strike teams. You have a problem that you've defined. There's not enough critical equipment. The supply chain is broken. So that problem statement turns into, how do we organize a team around that called a strike team that will address that issue? Has a finite life, right? It's only going to be, we're going to try to solve this problem in this period of time, and then we move on to the next thing we have to deal with. Now, some of those persist because PPE took a long time to get involved with, so that took some time to make that happen and finding those sources. But now we've been able to push that together into big suppliers who have plenty of inventory. So if people call in and say, hey, I need masks or whatever, we know where to direct them now. So the coordination part of the coordination center is probably the biggest thing that we do, is trying to put people in different spots. There was just an article that was released by Time Magazine last night, which is a project that we worked on with a company called Express Spa. Express Spa is that little place where you can get massages in the airport. If you've traveled to the airport, you see this little place where you can get a quick back rub between flights. They knew they were going to be shut down, so they decided, why don't we take our storefronts and make them into testing sites for the employees that work at the airport? Well, how would we do that? How would we get tests? How do we contact the governor's office to make sure we can get public health approval to do that? So they called us and said, we heard you guys were helping coordinate some of these things. How can we put that together? And so we put them in touch with Governor Cuomo's office, who we've been working with on ventilators already. So we knew some of the folks there. And we put them in touch with Quest, one of our testing partners, to see if they could supply the test kits and maybe some services to get the results back quickly to the employers. Because you have Big Delta, right? You can imagine Hartsfield, who's testing all of their employees anyway. But then you've got Aunt Annie's and the little shops that are in the airport. Those aren't big companies that have all those resources to make that happen. So can we set that site up? And so we called the CDC team that was doing screening at the airport and connected those dots. And the first one just opened at JFK yesterday. So now they'll move around to the large airports around the country. I think there's 23 different airports that they're going to start putting these into. So that's the coordination piece of what we do, and how we try to connect the dots of what's the public sector doing that can then support what's the private sector doing that can support the public sector needs. The airport would have then had to go to the county public health officials to do all that testing, and that really just wasn't possible. So this idea that they put together, and they used one of their grants from the government to reopen their business, to refund it to set up all their sites into testing sites. Really a nice story. So if you have time to look at it, we might send it out after this so you can just see how that worked.
I think that's a great idea.
Yeah.
And I mean, that's a great example of how people in other industries, other organizations in other industries are getting into the public health sector to be able to help out during this pandemic. So that's
Right.
a great example.
And,
Actually, oh, go
and
ahead.
that reconfiguration of business too is another thing that's worth thinking about. I think a lot of businesses post-COVID will be very different in not just how they operate and move and keep you safe as an employee and keep customers safe as they move through their patterns, but also how they think about working from home. I mean, that's been probably the biggest thing we've been hit with is how do we do better remote work, both through public health and through telemedicine and other things that have come around here. There's a whole nother set of markets coming up here of how you can deal with patients and customers remotely more effectively without having big offices and all the expense that puts that together. And that also lowers the threshold of investment for new business starts. If you don't have to figure out how you're going to pay $5,000 a month to rent a storefront, and you can really kick your business off using the tool we're on right now to work with clients and customers and partners, I think the world's going to change a lot in how we can build new businesses, especially in life sciences, where you've got enough of your overhead spent on the laboratory or investigation side of your business because it's very regulated, that anytime you can reduce costs on the front end, that's going to be a better business model to at least kick a company off.
Absolutely. I think that's a great point about how life sciences careers might change and public health careers in the future. I'm actually going to pull a question that we have in the chat.
Sure.
And so this is actually more focused on GHC3 and just the impact that it will have on Atlanta. So I actually spend a lot of time talking about this too. There are times where we see, careers in health sciences or life sciences and tech. They're not necessarily always in Atlanta. A lot of times people might have to leave Atlanta to find those opportunities. So, what are your thoughts on how GHC3 might impact opportunities for those careers in Atlanta and also within the rest of the United States?
Sure. So there are several different levels there at which I think there's going to be some impact. One is as businesses now become more acutely aware of public health requirements that they are going to, I mean, how many big companies really had a public health officer? I mean, they didn't really think about it before, right? So this is, as part of your health and safety team, yes, you have to report outbreaks of certain things to the public health office, but have you really been part of the strategy team to figure out how we can keep these folks safe? How do we report and test and those things? So just on that angle alone, there's a big part of what public health can do for individual businesses. I mean, that is going to change. And then that's going to tie, another thing that's been driven here is tying public health together with technology. Everything from contact tracing to different scanning thermometers to all kinds of things that companies didn't think about before are becoming now needed to keep your business open. So public health and public health capabilities tying into life sciences and med devices in ways that it's used by the corner coffee shop, that wasn't even something people would think about in the past. So I think there's opportunities there for growth in the area. But what I think the centrifuge, I think that CGHI is trying to build here is not just around this response and the education and the STEM school and other things that Maria's team is building, but also how does that attract other businesses? So as we build out our center, as we look at what responses we've had from tech companies. For example, we're creating a solutions gallery because we've had so many people just come in and say, I've got this new technology, and we've taken it from where it was and focused it on public health or these concerns that we have dealing with COVID. It's a whole new arm for our business to move this forward. How do they build that? How do they start it? A lot of these are ideas that just need investment. So as we build this up as a real incubator for public health technology, or just global health technology in general, this starts to build out jobs and opportunities and new companies that can spin out. And part of the plan here for the innovation for the Health Innovation Center is that we have a global health district where those companies can land, be mentored and incubated, and as that plan starts to gel, that's real estate on the ground, companies getting started. And that's what has attracted the Verizons and Microsoft's and Dell technologies and IBM's to the work that we're doing, is that you're building out a whole new sector here, and we want to be a part of it. So I have a meeting this afternoon with Verizon, who has made big investments in Atlanta already. Their first 5G healthcare lab is up north in Sandy Springs. And how do we now leverage that in ways that we can use the network to contact folks for public health, mental health, education, other issues that are happening here? Because GHC3 has strike teams in all those areas, getting back to work, back to school, back to worship. We have programs around how do we manage the broader network? How do we help the CDC with their next generation of science agenda? So what is it that they need to research so that this doesn't happen again the way it's happened this time? How do we advance communications? So Georgia State's program around digital comm and digital technologies, that digital media piece, is really going to be big in the future as to how you can get the word out about what's supposed to be happening right now. One of the big failings we've seen in the response so far is, what message are you supposed to believe here? You're hearing 5 different things. So how do we organize that in a way that we can get the best information, not rumors and other things, but just the best information out on social media and expand it quickly? And the Youth Ambassador program that our PIO, Brandy Mai's working on, I think to pull those networks together would be very effective in that use case.
Absolutely. And we actually have another question related to this. So how do you sustain the GHC3 platform post-COVID to really create that ecosystem that the private sector, public sector, and also philanthropic organizations can plug into to drive value and help in operationalizing and sustaining a capitalized infrastructure?
Wow, there's a huge question. Thanks for
I'm trying to get everything in there.
I know, that's awesome. I think that's something Maria would ask me. Say, how are you going to do this? But it has to do with, I think, as I said, attracting the private sector into this is the biggest part of it, right? Our goals and strategies are really aligning with what these companies are doing already, and how do we drive that into this space? So once you build that relationship and you build a platform that's sustainable, those things start to attract business rather than you having to go out and find it and consistently reach out for philanthropic funding to make that happen. But if you do have a platform for doing that work, and there's two big spaces I think we're going to work on at GHC3. One is building a big platform for informatics, right? How do we bring all this data in? If you can imagine a big command center, which is what we will be building, each one of those screens, as we look at a crisis, is going to have to show some kind of data, right?
Mm-hmm.
What is it, where that comes from, how it's acquired, how we put AI against it, how we build predictive models. That's all going to be part of that stack. And those are things that the big corporates are already interested in. Can we put our AI on it? Is that a test stack we can use for us? All of that brings dollars in to help sustain this and move it forward. And there's always a crisis somewhere. So as we look at becoming a good place to put philanthropic money to address specific issues, because we have the technology and reach to do that, and we can activate private sector corporations that are in other markets. For instance, Microsoft's not just interested in the US, but also in Africa and South America. So Dell, the same thing. They have big operations in these countries already. How are these ways that focusing on public health helps them grow their footprint as well?
Absolutely. I love the focus on public health now. That's what my background is in. So it's exciting to see that finally, take the front stage. So I guess with that too, one last question that we had was just general advice for young professionals in life sciences and, healthcare, and also, advice for those who are transitioning from more of a technical career to one in business, similar to how you focused on.
Sure. Well, I think having the technical and business background merged together has been very helpful for me, right? And being able to apply what I was learning in business school to a technology-based role that I had already ongoing. So I brought back to that class a lot of real life experiences, which in turn I think was very helpful for the professors that I had in that, oh, see how that works? See how this works? But being able to apply those things in the real world. So as you stage out your career, first of all, you're always learning. You're always learning. There's not a point where you say, oh, I know enough right now. So you have to be open to new experiences and new ideas. See where technology is going. See how people use that technology and try to stay in front of it. So you're never going, well, I don't know how to communicate with those people. I don't know what they care about, because you haven't really stayed plugged into it. And I'd also say staying open to opportunities. You never know when that letter in the mail or that blinking light's going to happen in your hotel room that says this might change the direction of my life in general, right? So am I open to that kind of change? And what am I afraid of? Because change can be scary, in that I've got this solid job here. I know what I'm doing tomorrow, and I could probably predict what I'm going to be doing for the next 5 years. Do I have the confidence in myself that no matter what I do, I'm going to be able to be at that point? And every time that I've said to myself, I'm not sure where the end of that, I'm not sure if I can do that or I'll ever be able to get back to this level, I was wrong. Right? Because that new experience raised me up to a whole nother set of both challenges and experiences that made me better and stronger, and in the end became a better part of my career. And also just there's times when you want to focus on how much money can I make at this, right? I want as much money as I can early on. But I've seen plenty of folks who've taken a great high-paying job on the front end that put them on a path that raised their salaries over time at an average of 2.5% to 3% a year, right? And that was the career path they were in a big company, and that was great, and they were, that was very secure and successful feeling. But if you look at how you can really stair step your career, it's going to be making those changes. Taking time to learn about what you do, make yourself valuable in that space, and then taking that leap to the next section. And you're now adding 50% to your base salary because you've found a way to move on and to leverage your experiences here. I'm not saying that job hopping is what everybody needs to do. I'm just saying that if you really want to look at how to accelerate your career, you've always got to be looking outside of what you're doing.
I think that's great advice. And we actually did get one other question in the chat, and this is related to the patent that you had on the chair for paralyzed patients.
Sure.
So was this a rehaul of the system that was already being used, or was it the first of its kind?
Yeah, well, I mean, if you can imagine, everybody's seen a chair, right? There was nothing fancy about that. The patent itself came from the fact that it could flatten out and actually apply you to the surface that you were on. So it tilted up, and so if you're paralyzed, you'd have to pick your legs up and throw them over. But if I had a leg piece that would lay up, and then I could move you onto that, the telescoping pillar in the middle, which had to float and was at 3 levels, instead of having a motor drive a gear, the motor actually moved up and down the gear to drive it. That was probably the most unique piece of it. Several of the claims in that patent were around that device, and that's what attracted a company called the Magnetic Corporation out of Switzerland, who came and acquired that. Not from me, but from the university, because as a student, you really don't have any rights. So you get your name on it, but other than that, it's all those dollars go back to the school. Awesome. The downside of patenting things at school.
There's a lot more to be said about that.
That's right. I could have a whole session on that.
All right. Well, thank you very much for taking the time to share your background.
Certainly.
And also more about GHC3. There's definitely a lot going on, and it's really exciting and obviously great to learn more about you. If anybody has any suggestions for future panelists for any of these sessions, feel free to reach out to Georgia Bio. You can find their email address on their website if you go to Georgia Bio's website. And feel free you can reach out to me if you have any questions. Also, my email is Alexa, ALEXA.morse, MORSE, @devices.net. And that's devices like medical devices. But Ken, thank you very much again.
Certainly.
We really appreciate it.
Thank you. It was a pleasure. All right.
Thanks.
Have a great day, everybody. Take care.